Hello, my name is Nishat Noor and welcome to Millennium Headlines. This week's top headlines are: Weekly address of President Obama, focused on the fight against Ebola. Prime Minister Sheikh Hasina reaches Abu Dhabi. European Union asks Britain to pay extra $2.7 billion. 31 Egyptian soldiers are killed as militants attack in Sinai. Health officials expect to start vaccine trials in West Africa as early as December. Tangled portrait of a student emerges in Washington shooting. Now the details to this week's top headlines. Discusses the measures we are taking to respond to Ebola cases at home while containing the epidemic at its source in West Africa.
Hi everybody. This week we remain focused on our fight against Ebola. In Dallas, dozens of family, friends, and others who had been in close contact with the first patient, Mr. Duncan, were declared free of Ebola, a reminder that this disease is actually very hard to catch. Across Dallas, others being monitored, including healthcare workers who were most at risk, were also declared Ebola-free. 2 Americans, patients in Georgia and Nebraska who contracted the disease in West Africa, recovered and were released from the hospital. The first of the 2 Dallas nurses who were diagnosed, Nina Pham, was declared Ebola-free, and yesterday I was proud to welcome her to the Oval Office and give her a big hug. The other nurse, Amber Vincent, continues to improve as well. And in Africa, the countries of Senegal and Nigeria were declared free of Ebola, a reminder that this disease can be contained and defeated. In New York City, medical personnel moved quickly to isolate and care for the patient there, a doctor who recently returned from West Africa. The city and state of New York have strong public health systems, and they've been preparing for this possibility. Because of the steps we've taken in recent weeks, our CDC experts were already at the hospital, helping staff prepare for this kind of situation. Before the patient was even diagnosed, we deployed one of our new CDC rapid response teams, and I've assured Governor Cuomo and Mayor de Blasio that they'll have all the federal support they need as they go forward. More broadly, this week we continued to step up our efforts across the country. New CDC guidelines and outreach is helping hospitals improve training and protect their healthcare workers. The Defense Department's new team of doctors, nurses, and trainers will respond quickly if called upon to help. New travel measures are now directing all travelers from the 3 affected countries in West Africa into 5 U.S. airports where we're conducting additional screening. Starting this week, these travelers will be required to report their temperatures and any symptoms on a daily basis for 21 days until we're confident they don't have Ebola. Here at the White House, my new Ebola response coordinator is working to ensure a seamless response across the federal government. And we've been examining the protocols for protecting our brave healthcare workers. And, guided by the science, we'll continue to work with state and local officials to take the necessary steps to ensure the safety and health of the American people. In closing, I want to leave you with some basic facts. First, you cannot get Ebola easily. You can't get it through casual contact with someone. Remember, down in Dallas, even Mr. Duncan's family, who lived with him and helped care for him, even they did not get Ebola. The only way you can get this disease is by coming into direct contact with the bodily fluids of someone with symptoms. That's the science. Those are the facts. Sadly, Mr. Duncan did not survive, and we continue to keep his family in our prayers. At the same time, it's important to remember that of the 7 Americans treated so far for Ebola, the 5 who contracted it in West Africa, plus the 2 nurses from Dallas, all 7 have survived. Let me say that again. 7 Americans treated, all 7 survived. I've had 2 of them in the Oval Office. And now we're focused on making sure the patient in New York receives the best care as well. So here's the bottom line. Patients can beat this disease, and we can beat this disease. But we have to stay vigilant. We have to work together at every level, federal, state, and local. And we have to keep leading the global response, because the best way to stop this disease, the best way to keep Americans safe, is to stop it at its source in West Africa. And we have to be guided by the science. We have to be guided by the facts. not fear. Yesterday, New Yorkers showed us the way. They did what they do every day, jumping on buses, riding the subway, crowding in elevators, heading into work, gathering in parks. That spirit, that determination to carry on, is part of what makes New York one of the great cities in the world. And that's the spirit all of us can draw upon as Americans.
The Prime Minister of Bangladesh, Sheikh Hasina, has arrived in Abu Dhabi for a working visit to a UAE, during which she will meet a number of senior officials. The visiting Bangladesh Prime Minister and her delegation members were welcomed on her arrival by Miriam bint Mohammed Khalfan Al Rumi, Minister of Social Affairs, Saeed bin Hajar Al Sheikh, the UAE ambassador to Bangladesh, and other officials.
The Prime Minister of Bangladesh, Sheikh Hasina, has arrived in Abu Dhabi last Saturday for a working visit to the UAE, during which she will meet a number of senior officials. The visiting Bangladesh Prime Minister and her delegation's members were welcomed on arrival by Miriam bin Mohammed Khalfan Al Rumi, Minister of Social Affairs, Saeed bin Hajar Al Sheikh, and the UAE Ambassador to Bangladesh, Mohammed Imran, and other officials. A number of agreements are scheduled to be signed during the visit, including those on security cooperations and transfer of sentenced prisoners. The visit is very crucial as the UAE has restricted its labor market for the Bangladeshi workers like many other countries. The country is the second largest manpower destination for the remittance dependent Bangladesh economy after Saudi Arabia. More than 1 million Bangladeshis currently work there, but a section of them has engaged in different corrupted activities, leading to imposition of restrictions. Millennium TV, Naeem Mohammed.
A demand from the European Union for an extra payment worth $2.7 billion would not be welcome news for any European leader. For Prime Minister David Cameron of Britain, the request on Friday comes at a particularly difficult time, as he faces a crucial electoral battle with the populist party that wants the nation to walk away from the European Union.
A demand from the European Union for an extra payment worth $2.7 billion would not be welcome news for any European leader. For Prime Minister David Cameron of Britain, the request on Friday comes at a particularly difficult time, as he faces a crucial electoral battle with a populist party that wants the nation to walk away from the European Union. Mr. Cameron quickly rejected the demand as totally unacceptable.
Let me put it like this. Of course, in an organization like this, if your economy grows a little faster or your economy grows a little slower, there are adjustments. And there can be adjustments every year. And we've seen them. Sometimes you pay a little bit more, sometimes you pay a little bit less. But it has never been the case that a €2 billion bill has suddenly been presented. And it is not acceptable. It is an appalling way to behave. I'm not paying that bill on the 1st of December. If people think they got another thing coming. It is not going to happen.
The request for the money, which is about £1.7 billion, came after a recalculation of data showed that the British economy performed better in recent years than previously thought. That suggested that its payment into the European Union budget should rise according to the bloc's formula for contributions. The payment would come in addition to Britain's annual payment of about $13.8 billion to the bloc's treasury. Speaking at a news briefing at European Union Summit meeting in Brussels, Mr. Cameron described the additional fee as unjustified and said Britain would refuse to pay it. Millennium TV, Naeem Mohammed.
Two attacks on Egyptian military positions in the Sinai Peninsula on Friday killed at least 31 soldiers, according to security officials and the state news media.
Two attacks on Egyptian military positions in Sinai Peninsula on Friday killed at least 31 soldiers, according to security officials and state news media. The scale of the attack underscored the difficult challenges the Egyptian government continues to face in reestablishing firm control of northern Sinai near the border with Israel and Gaza Strip.
There was foreign support behind this to organize this attack against the Egyptian army. Be careful of plots against you.
متوقعينه واتكلمنا فيه وقلنا عليه.
We know what's going on, and we will now move forward.
من قبل 3/7 واحنا عارفين ان ده مشوار احنا هنمشيه.
Egyptian officials have said repeatedly that they have largely contained the insurgency there, but the complexity of Friday's attack, said to involve multiple vehicles and heavy weapons, suggested that the militants were growing more sophisticated. Millennium TV.
If the bullet-scarred American Sheikh has an archetype for a school gunman, it looks very little like Jalen Ray Freiberg. He was not a loner or a known misanthrope. Far from it. He was a football player with $1 million smile, popular enough to be elected homecoming prince of his freshman class in Marysville-Pilchuck High School.
If the bullet-scarred American Sheikh has an archetype for a school gunman, it looks very little like Jalen Ray Freiberg. He was not a loner or a known misanthrope. Far from it. He was a football player with $1 million smile, popular enough to be elected homecoming prince of his freshman class at Marysville-Pilchuck High School. When Jalen pulled out a handgun in the school cafeteria on last Friday, according to witness, he did not randomly target fellow students, nor did he point it towards authority figures. Instead, he fired at his own friends, killing one student and seriously wounding 4 others before killing himself. Family members identified 2 of the wounded victims as Nate Hatch, 14, and Andrew Freiberg, 15, and said they were Jalen's cousins. They were being treated at Harborview Medical Center in Seattle. Officials at Providence Regional Medical Center Everett on Saturday identified 2 14-year-old girls, Shiley Chuck Lentz and Gia Soriano, who were being treated there for gunshots. The girls and Andrew Freiberg remained in critical condition, while Nate Hatch was in serious condition. However, neither officials nor relative had publicly identified the female classmate who was killed. Millennium TV, Naeem Mohammed.
Public health authorities said on Friday that they hope to begin trials on Ebola vaccines in disease-ravaged West Africa as early as December and could know around April whether they were effective. Clearly, the way for possible mass inoculations to stem the epidemic.
Public health authorities said last Friday that they hope to begin trials of Ebola vaccines in West Africa as early as December and could know around April whether they were effective, clearing the way for possible mass immunizations to stop the widespread of Ebola virus. Vaccine is not magic bullet, said Dr. Mary Paul Caney.
These trials will incorporate the largest number of volunteers and will be very important in terms of determining both the safety and the immunogenicity. And these data are absolutely crucial to allow decision-making on what dose level should go in the efficacy testing in Africa. These trials will all start in the coming 2 weeks, I would say, and we expect both for the chimp adenovirus as well as from the VSV vaccine to have initial results. Of course, these trials will continue for 6 months to a year, but to have initial results about safety and immunogenicity, to have a choice of a dose level by the end of this year, so in December. That's clearly the plan.
Trial of the drugs in progress, would they come before the vaccines or that?
There is still a possibility that will fail, but everybody is putting things in order for being able to move to West Africa in January. So this will most likely be in the form of efficacy trials, but in order to have a response as quickly as possible, these trials will need to be quite large and enroll quite quickly. For the record, these are the projections that were made by the company a few weeks ago, and since then there has been a re-evaluation of what would be possible if really all times were compressed. and I would suggest, because I wouldn't be able to speak on behalf of a company, of course, but you might want to ask this question to the company again. We are aware of the fact that some vaccines are also in development in Russia. And so we are in contact with the Russians to see when they could be available for testing in Africa, and what type of doses in terms of quantity could be available in the months to come. In March, there was absolutely no belief that a vaccine could be brought online in time to respond to something that people were still thinking would be a normal Ebola outbreak.
Now we're going to show you a chart that would have all the details of Ebola patients have treated outside of West Africa. The chart was dated from August 2nd to October 23rd, 2014 for the New York Times. Thank you for watching Millennium Headlines, and we'll see you next week.